Good day! This is Charles Saxelesta from BSN 12H. In this video, I will be performing a return demonstration on the parental medication administration. So there are 3 sites which will be administering medication to. These are the intradermal, or this their part, and then the intramuscular, and then the subcutaneous. So, before starting the drug administration, there are general preparation we must remember to do. So, this general preparation are applicable to the 3 procedures we'll be performing. So, the first is check the doctor's order. And after that is check the medication administration, or MAR. And so, this is for us to properly check if the medication we have is the right medication ordered by the physician for our patient. So, we'll also cross the check label on the medication carefully against the MAR to make sure that we have prepared the correct medication. Okay, so it's perfect. So next is to follow the 3 checks for administration medication, and this is to read the label on the medication. So when it is taken from the medication card, before withdrawing the medication and after withdrawing the medication. So this is also for making sure that we have the right medication to administer. Lastly, we have to organize the equipment ahead of time, so so we can have a smoother and orderly process, and also to promote time efficiency. So for this demonstration, we'll need syringes that which have there. So we have the 3 types of syringes. The first is the 1 ml. Well, the 1 ml which will be used for the intradermal, and after that is the 5 ml for intramuscular, and the last one is the 3 ml syringe for the subcutaneous site. So then we also have here the vial and ampule, and for the medication and cotton pad and alcohols. So, the first parenteral medication that I am going to perform is the intradermal administration. So, intradermal injection is commonly used for tuberculin skin testing, but can also be used for allergy testing and local anesthetics. So, but now, before proceeding with the drug administration, we'll start by procedure with the preparation of the medication for vials. So, first thing we'll do is to make sure that we have performed hand hygiene and observe appropriate infection prevention. So, since I have already performed hand hygiene and sanitation for prevent cross-contamination. So, we'll now start by preparing the drug for withdrawal. Also, okay, so we'll now start by preparing the drug for withdrawal. So we'll have to mix the solution by rotating the vial between the palms of the hands and make sure not to shake it. Just rotate it. And after that, we'll remove the protective cap of the vial and clean it with an antiseptic wipe by rubbing in a circular motion. Okay, I'm going to pick a cotton ball and then I'm going to wipe it in a circular motion. After that is described, discard the cotton ball. So wiping it in the antiseptic will disinfect its lid and to prevent cross-contamination. So now the medication is ready to withdraw. So here we have a syringe with a needle attached. So we'll carefully remove its cap and then induce the air by withdrawing drawing up air with an amount equal to the volume of the medication to be withdrawn. Okay, I'm going to remove the cap. I'm going to withdraw a amount like yes, and then after that is and then we'll inject the air into the vial while keeping the bevel of the needle above the surface of the medication to ensure sterility. Okay, and after that is I am going to inject the air. And after this, we'll now withdraw the prescribed amount of medication by inverting the vial with raw amount of the medication needed. So we'll also make sure to position it in the eye level so we can accurately withdraw the amount of the meds needed. Okay, I am going to perform it. Okay. So after successfully withdrawing the medication, we'll have to remove this aspirating needle and replace it with a right size needle that will be used for actual administration of the medication, and then discard the needle used in aspirating. Okay, I am going to remove the old needle and then replace it with a regular needle. Then after and also do not forget to put a marker for the name of the drug, the dosage, so that we won't forget the medication was drawn into the syringe and we won't get confused. Okay, we are done. Okay, now we'll start the ampule preparation by flicking the upper stem of the ampule several times using our fingernails. Okay, so flicking this will bring all medication down to main portion of the ampule. And after that is we'll put the ampule on a flat surface. And then using place a piece of sterile gauze pad or alcohol, wipe between the ampule neck or around the ampule neck. Okay, I'm going to get the gauze pad and then wipe the neck and around the neck. After that is discard the gauze pad. And then place the antiseptic wipe back over the top of the ampule before breaking off the top, and then break off the top. So making sure to bend it towards to avoid getting broken fragments to others. After that is okay. So then discard the broken top piece of the ampule carefully. Then we'll now withdraw the medication from the ampule. So we have our ampule on a flat surface, and we already have here our syringe and with a filter needle attached. So now we'll remove the cup from the filter needed and insert the needle into the center of the ampule. So carefully not to touch the rim of the ampule with the needle tip of a shaft to avoid contamination. I'm going to, and after that is, and then we'll now withdraw the amount of the medication needed. Okay. Okay, so after that, we'll dispose the needle by placing the sharps container and replace the filter needed with a regular needle. Okay, I am going to remove it, discard and replace new needle. So done. And after that is I am going to add marker to know what the medication is. Thank you. So after the preparation, we'll now administer the medication and we'll start with the intradermal administration. So first off, we'll explain the procedure to the client, and this is to inform the client on what to expect in the procedure and how they can appropriate. So hello ma'am, I am Charles Saxel-Hasta, your student nurse for today. So as ordered from Dr. Yoon has ordered for a penicillin skin test, which means I have to inject and to inject just a small amount of penicillin in your skin. So to check if you have allergies or not with the penicillin medication. So this medication will be administered via intradermal route. So this will involve injecting medication into your skin layer, and this injection will also produce a bleb or a blister, and you will also feel a slight prick as the needle enters your skin. So before I proceed, may I ask, do you have concern before the procedure, ma'am? Okay. So after explaining, the client will provide her privacy so that she can be at ease. So I already locked the doors and closed the curtains beside me. So then we'll select the site to be administered, and it is 3 to 4 widths before antecubital space and 1 hand above the wrist. So the forearm is convenient and easy to locate for introducing an agent intradermally. So after that is we'll now inspect the patient to choose an injection site free of lesion and discoloration. So ma'am, can I see your hand? Okay. Okay. Since the patient has no skin lesions, I will now, after choosing position our client's arm into a flat surface, so make sure that elbow and forearms are supported and client is comfortable. So are you comfortable with your position right now, ma'am? Okay, so then now, since I've already wear a gloves, so I will going to start. So we'll now cleanse the skin at the site using a cotton ball with a firm circular motion. So first, I am going to pick cotton balls and then circular motion. Okay, and then discard the used cotton balls. After that is, now we'll prepare the syringe for the injection. So in holding the syringe, we'll use our dominant hand, which is my right hand. Close the hub holding between the thumb and 4 fingers, making sure to hold needle almost parallel to the skin surface with a bevel of needle up to maintain the sterility. So then we'll now remove the needle cup and make sure na it is not contaminated. So after that, I will expel the air bubbles from the syringe. This makes sure only liquid medication will enter the body. I will going to tap. Okay, so now I will inject the fluid. So we'll first have to stretch the skin on and inject site, pulling gently with a thumb and forefinger to our non-dominant hand. Then insert it slowly at 5 to 15 degree angle through the dermis, then epidermis. Five to 15 degrees. Okay, perfect. And then discard the used cotton. And then we should be careful not to massage the area to avoid hurting the patient and infecting the site. So I will going to tap. And then we'll encircle the wheel with a pen. So this marked areas with wheels, they'll also instruct patient not to rub the wheel or erase the mark. So after we'll now do the procedure. Okay. And then after that, we'll now remove our gloves and do hand hygiene and aftercare for our materials. So now we'll then document all relevant information to keep records. So this includes the medication given, a time, route, and dosage, and the reaction of the patient. So then it will also needed that we check the patient after 30 minutes to see if the areas with wheals or blisters healed or become more red or larger. So if they had a negative skin reaction to the procedure done. So end result from our checking with the patient should be documented. So no reaction, skin is normal. Intramuscular administration. So intramuscular injection is the introduction of medication deep into the muscle tissue where a large network of blood vessels can absorb it readily and quickly. So this is done to allow less painful administration of irritating drugs and to allow more rapid absorption of the drug compared to subcutaneous injection. So let us start by performing hand hygiene. So I've already had prepared hand. I already done hand hygiene, and then and next is to prepare the client to provide them with privacy by closing the windows. So I've already closed the windows and the curtains by side. So now next we'll introduce ourselves to the client and proceed to our patient. So good day, ma'am. My name is Charles Asalesta, your student nurse for today. So may I know your name and your age, please?
Christine enrolled July 14, 2002.
Okay, thank you. So, ma'am, this moment we are going to administering a medication via intramuscular route. So we'll be administering this via your deltoid muscle. So the medication ordered to you in a penicillin, which is an antibiotic prescribed to treat susceptible bacterial infection. So this may cause side effects like drowsiness, nausea, vomiting, or abdominal pain. So if you have any concern, ma'am, feel free to raise it. Okay po? Thank you. So now, next we'll position our patient comfortably. This is to have an easy access to the injection site. Okay, ma'am, are you comfortable with your position? Okay, thank you. So now, the site will be administering is to deltoid muscle. So we have to check this site if it is free from lesions, scars, or swelling. Okay, ma'am, I am going to inspect if you have any lesions or swelling. Okay, so since the patient has no swelling and lesions, so remember, so if injections are too frequent, alternate sites, avoid using the same site twice in a row. So, and also if the patient is uncooperative, we should ask for assistance and help. So next is we'll now clean the site, and we have antiseptic swab. So using a circular motion, start the center and move upward about 5 centimeters to disinfect the injection site. Okay, ma'am, I am going to perform disinfections, and it is for 5 centimeters in circular motion. Okay, discard. Thank you. So then we'll get the syringe for injection. So we have the syringe with the medication withdrawn from an ampule. So the syringe needle have also been replaced, as you can see. And now we'll remove the cover of the needle, and then carefully, without contaminating, we should also be careful not to drip medication on the needle prior to the injection. So we'll now start inject the medication. Okay, so and then using our dominant hand, we will be pulling the skin approximately 2 to 5 centimeters or 1 inches to the side. So this is called the Z-track technique, which is used to decrease pain and to help making sure that the medication goes directly to the muscles and not to subcutaneous tissues. Then we'll hold the syringe between the thumb and then the 4 fingers, and using as if like you are holding a pen. So piercing the skin quickly and smooth at a angle of 90 degrees. So now, while I am going to position. Okay. After that is we are going to put eye pressure, and then tape. So after that, we'll discard the needle as I have done earlier, and then perform an aftercare, including the removal of gloves and holding the and doing hand hygiene. So lastly, after that is documentation is a must. So this is to keep records of all relevant information. In documenting will include the time, administration, drug name, dose, route, and client's reasons. So lastly, we'll also check the patient to assess the effectiveness of the medication and record any unusual reactions. The last procedure is the subcutaneous injection. So subcutaneous injection is the introduction of a small amount of solution by means of syringe and needle into the adipose tissue beneath the skin. So this is to deliver medication more rapidly to the bloodstream than oral administration and to prevent slower and sustained drug administration than intramuscular injection. So we have already done the general preparation and the preparation of the medication from ampules. So we can now start with the injection procedures. So we'll start with the hand hygiene. So since I already have done applying hand hygiene, so I am going to now prepare the client and introduce ourselves, and as well as explain the procedure to them, and we'll also explain the purpose and effect of the medication to make sure that our client is well aware and informed of the medication they'll be taking. So good day, ma'am. My name is Charles Axel Hester, your student nurse for today. So, may I know your name and your age, please?
Christina, July 14, 2000.
Okay, ma'am, thank you. So, please, ma'am, so this moment we are going to do administering medication via subcutaneous route. So, we have inject insulin in this part of your abdomen. As you may know, insulin controls blood sugar since you have a type 1 diabetes. So, you'll be experiencing pain. So next, we'll move to the site selection and inspection. So the selected site free of tenderness, hardness, swelling, scarring, itching, burning, or localized inflammation. So this site we'll be using is here on the abdomen of the patient, and making sure that the skin of the administration site appears to be healthy and free from irritation and inflammation reduces the discomfort of infection. So I am going to palpate if any have skin lesions or swelling. Okay, ma'am. So since the patient have no swelling, I am going to start the medication. So now we'll now wear our gloves since I already wear gloves. So now I am going to cleaning first by the cotton balls and in his abdomen, and then by circular motion, and then discard. After that is remove the needle cap by pulling straight off. This one is remove, and after that is I am going to discard the injection, the cap rather. So remove the needle cap by and then hold the syringe between the thumb and forefinger on your dominant hand, which is my right hand, and then holding like a dart, this one. So then we'll grasp or pinch the area and hold in a cushion fashion to help ensure that the needle enters the areola connected tissue. So then we'll insert the needle quickly and firmly at 45 to 90 degrees angle, and then this is because inserting it quickly would minimize the pain. And yeah. Okay, now I am going to perform, ma'am. I'm going to pinch and then release, and there you go. And then discard. And if blood appears, make sure to apply gentle pressure using a gauze pad until it stops. Okay, so after that, we'll dispose the materials used, and I already disposed everything that I've used to avoid contamination. So then we'll position our client comfortably and do an aftercare. Are you okay, ma'am? Can you sit comfortably? Okay, thank you. I am going to do an aftercare on my equipment that I've been using. And then I am going to remove my gloves and perform hand hygiene. Discard. And then we'll assess the patient to see effectiveness of the medication if they had a negative reaction to it. So lastly, we do documentation. So this is to keep a record of all relevant information. So in documenting, will include the time, administration, drug name, dose, route, and the client's reactions.